Imagine a weakening and wasting of the muscles closest to the center of the body, such as the thighs, hips, shoulders, and upper back, which with age inevitably gets worse. Having a body that whispers revolt with each movement. This is not the healthy protest of exhausted muscles after a workout. It is a steady low hum of resistance. This is a taste of what spinal muscular atrophy (SMA) feels like. What is spinal muscular atrophy (SMA)? Come, let's take a look at what this illness is all about in detail. Before we get into the details, make sure you've hit the like button for more informative videos. Spinal muscular atrophy (SMA), a genetic neuromuscular illness called spinal muscular atrophy, results in weakening and degeneration of the muscles. Individuals with spinal muscular atrophy (SMA) lose motor neurons, a particular class of spinal cord nerve cells that regulate muscle contraction. The nerve signals that cause muscles to contract are not received by muscles in the absence of these motor neurons. In medicine, the word atrophy means smaller. Some muscles in SMA shrink and weaken from inactivity. In the US, there are about 10,000 and 25,000 adults and children who have been diagnosed with SMA. This is a rare condition that affects 1 in every 6 to 10,000 children. How does one end up with spinal muscular atrophy, SMA? The survival motor neuron gene 1, SMN1, is the gene responsible for the most prevalent type of SMA. It can be mutated or absent. The survival motor neuron SMN protein, which is produced by the SMN1 gene on chromosome 5q, keeps motor neurons healthy and functioning normally. Insufficient amounts of the SMN protein are present in people with SMA, which results in the death of motor neurons in the spinal cord. Skeletal muscle weakness and wasting. The muscles of the upper limbs and arms, as well as the trunk, the chest, are frequently weaker than that of the feet and the hand. The same genes alter in several ways, leading to spinal muscular atrophy. SMA is inherited autosomally recessive, meaning that the affected person has 2 mutant genes, typically 1 from each parent, with the exception of rare cases. A single faulty gene can cause an individual to be a carrier of the illness without causing any symptoms. Babies and children are most commonly affected by spinal muscular atrophy, which impairs their ability to use muscles. The brain and spinal cord nerve cells degenerate when the child develops SMA. The messages governing muscular action are stopped by the brain. The child's muscles weaken and contract as a result, and they may experience difficulties with head control, sitting independently, and even walking. As the illness worsens, they may occasionally experience difficulty breathing and swallowing. How exactly is spinal muscular atrophy (SMA) diagnosed? In order to comprehend how the diagnosis is made, we should keep in mind that SMA symptoms differ depending on the kind. There are several signs of SMA that are similar to that of the neuromuscular diseases such as muscular dystrophy. To figure out the cause of symptoms, the healthcare practitioner will perform a physical examination and obtain a medical history. To diagnose SMA, the physician may require 1 or more following tests. 1. Blood test. A blood test for enzymes and proteins can detect elevated creatine kinase levels. This enzyme is released into the bloodstream as the muscles deteriorate. 2. Genetic test. This blood test detects issues with the SMN1 gene. A genetic test is 95% successful at detecting the mutated SM1 gene. Some states routinely screen newborns for SMA. Number 3. Nerve conduction test. An electromyogram (EMG) is a technique for measuring the electrical activity of nerves and muscles. 4. Muscle biopsy. A muscle biopsy is only performed on rare occasions by a physician. This process entails extracting a small piece of muscle tissue and sending it to a laboratory for analysis. A biopsy may reveal atrophy or muscle loss. Now wait, this isn't the only approach to check for spinal muscular atrophy. If you are pregnant and have a family history of SMA, prenatal tests can reveal whether the growing fetus has the disease. But these tests might raise the chance of miscarriage and pregnancy loss. Prenatal testing for SMA include amniocentesis. The obstetrician inserts a thin needle into the abdomen to extract a little amount of fluid from the amniotic sac. A laboratory specialist pathologist examines the fluid for SMA. This test should occur after the 14th week of pregnancy. chorionic villus sampling (CVS). The obstetrician takes a tiny tissue sample from the placenta via your cervix or stomach. A pathologist examines the specimen for SMA. CVS can occur as early as the 10th week of pregnancy. The worst thing about spinal muscular atrophy is that there isn't a cure for this. Treatment options vary depending on the type of SMA and its symptoms. Many patients with SMA might benefit from physical and occupational therapy, as well as assistive devices such as orthopedic braces, crutches, walkers, and wheelchairs. It's vital to realize the SMA affects people differently. Some people experience just modest weakness, while others get a more severe form of the condition. However, many people with SMA struggle with their own bodies and their limits that they impose.